Hello everyone, myself Dr. Anamika. This is an awareness video about Hansen or leprosy. As we all know that 30th January 2022 was observed as a World Leprosy Day. This is a video from Department of Dermatology, Dr. Vittalrao V.K. Patil's Foundation, Medical College and Hospital, Ahmednagar. To briefly know about the leprosy or Hansen disease, World Leprosy Day is observed every year on the last Sunday of January. It was established in 1954. It aims to raise awareness about the leprosy, known as a deadly disease, highlights that leprosy can now be successfully treated and cured, aims to completely eradicate leprosy across the world. Many people around the world continue to suffer from this curable disease due to lack of access to basic medical care and continued stigma surrounding the illness. The IADVL theme for 2022 was United for Dignity, elimination of all traces of societal stigma and discrimination against the disease and the people living with disabilities. The history of the disease is leprosy is the oldest disease known to the mankind, also known as Hansen disease. Lepra means scaly in Greek. Kushtaroga, that is Indian word for leprosy, means punishment from the god. The causative agent for disease is Mycobacterium leprae, also known as M. leprae. The prevalence of disease was 216,108 new leprosy cases registered globally in 2016. The year 2016 to 17 started with 0.86 lakh leprosy cases on record as on the 1st April 2016 with prevalence of 0.66 per 10,000 population. 554 districts, that is 81.23%, total of 682 districts also achieved elimination by March 2017. The main mode of transmission is through droplet infections, aerosols, which contains Mycobacterium leprae. The contact transmission, that is from person to person by close contact between infectious and healthy but susceptible person, skin to skin, fomite borne or soil. Other minor routes of transmissions are breast milk, insects, vectors, and tattooing needle. The incubation period of the disease ranges from 3 to 5 years. So it will take 3 to 5 years for the enter of the bacteria to the first appearance of the symptoms. A few of the clinical features which would be known to everyone are the hypopigmented patches may be present over the skin, which can be seen in the image. The partial or total loss of cutaneous sensation in the affected area, presence of thickened nerves, presence of acid-fast bacilli in skin or mucous membranes. The exposure depends on the age where children, young adults, and old age people are equally susceptible. The both sexes can be affected, but there is a higher prevalence in male. The main sites of the predilections are peripheral nerve, skin, muscle, eyes, bones, testes, and internal organs. If disease is left untreated, we can see what can happen to the patient. Here the image shows the uh, claw hand deformity with mutilation of the fingers. Here first image shows an unhealed ulcer over the foot. The second image shows sawn neck deformity of the fingers. And if treated in time with proper care and treatment taken, here we can see the pre and post pictures of the patient with treatment. The photo is showing the nodular lesions over the face, also known as leonine facies. Then moving to the treatment part, treatment is provided free of cost by the government of India. There are different color packages for the different types of leprosy, that is possibacillary and multibacillary, and different packages for the adults and child. Possibacillary treatment has to be taken for 6 months and multibacillary treatment has to be completed in 12 months of the treatment. 12 months. Here are the few facts which we should know about the leprosy. That leprosy is completely curable with drug therapy. MDT is freely available everywhere. Early diagnosis and treatment stops the spread of leprosy. Your skin specialist, that is dermatologist, is a leprosy specialist as well. So visit it in case of a need. Early diagnosis and treatment prevents the disability. MDT can cure leprosy from the body. Let us unite to clear it from our minds. Then the deformity which we have seen earlier and which we were talking about. So why is it so important? Because certain deformities are preventable and certain deformities are difficult to prevent but are amenable to the treatment. So what we can do for the treatment are the regular exercises for claw hand. Like you can see in the picture where person is holding his metacarpophalangeal joint and moving his interphalangeal joint of finger. This can be done several times of the day. Then other picture shows wax bath and oil massage, which can be also proven helpful for the claw. Then these are the various splints which can be used. Then grip aids for the advanced deformities like absorptions and amputation. This help the patient to hold the object and increase the efficiency day-to-day work. Then Neela Shah's instant aid kit, which is provided free by Novartis Foundation. The kit contains Velcro rubber grip aid, a spoon, glass with handle, comb, toothbrush, which again helps in patient in doing their day-to-day daily activities. Then there is a self-care kit which consists of a scraper, antiseptic cream, an antiseptic lotion, sterilized gauze pieces, a bottle of Vaseline, bandage with scissors, sticking plaster, and lastly the MCR footwear. These kits and these footwears are available free of cost by the government of India. Uh, so this was the brief discussion about the leprosy and some of the points which every person should know, so that together we can put a stop to a discrimination and stigma against people with leprosy. We can learn to recognize symptoms and know when to see a doctor for the diagnosis. Educate yourself and community and separate the facts and myths about the disease. Let's stop the discrimination against leprosy. Thank you so much.